In your phlebotomy exam, you will absolutely be tested on the gray top tube and its critical role in glucose preservation. This tube contains a powerful combination of additives, sodium fluoride and usually potassium oxalate. The exam will expect you to know the specific job of each. Sodium fluoride is not an anticoagulant, it is an antiglycolytic agent. This means it's a preservative that stops glycolysis, which is the process where red blood cells consume or break down glucose in the sample. If glycolysis isn't stopped, the glucose level in the tube will artificially decrease over time, leading to a falsely low result for the patient. The anticoagulant in the tube is potassium oxalate, which works by binding to calcium to prevent the blood from clotting. A classic exam question will present a scenario and ask you to identify the function of sodium fluoride. The correct answer will always relate to inhibiting glycolysis or preserving glucose. You must know that the gray top tube is the required choice for specific tests where glucose stability is paramount. This includes the glucose tolerance test, or GTT, fasting blood sugar, lactate levels, and blood alcohol or ethanol level testing. The reason it's used for ethanol testing is that bacteria, if present, can also consume glucose and produce alcohol. So stopping glycolysis prevents this potential contamination. Now let's discuss a common point of confusion that the exam loves to exploit: the difference between glucose values from a gray top tube versus a green top tube. A green top tube contains heparin, which is an anticoagulant but not an antiglycolytic agent. If a doctor orders a basic metabolic panel which includes glucose, it's often drawn in a green top tube. However, if that green top sample sits at room temperature for a few hours before being analyzed, the glucose level will be inaccurate and falsely low because the red blood cells will have continued to metabolize the glucose. A question might describe a significant delay in sample processing and ask which tube would provide the most accurate glucose result. The answer is always the gray top tube. Another exam trap is to confuse the roles of the additives. You might see a question asking which additive in the gray top tube prevents clotting. Remember, that's the job of potassium oxalate, not sodium fluoride. To help you remember the primary function of this tube, use this simple phrase: gray stops glucose from going away. This mental shortcut connects the color of the tube directly to its main purpose of preserving glucose levels. The gray top tube is drawn last in the standard order of draw to prevent its additives from contaminating other samples. For example, the potassium oxalate could interfere with potassium readings in a green top tube, and the sodium fluoride can inhibit enzymes needed for other chemistry tests. Understanding this isn't just about passing the test. It's about ensuring patient safety and diagnostic accuracy. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.